Welcome to MRI Screening and Safety. This lecture is part of the RAD 240 module. My name is Sarah Myers, and I will be your instructor for this section. MRI Screening and Safety is one of the most important aspects of MRI today. We have to be careful with regards to the strong magnetic field produced by today's superconducting magnets. There are many precautions that we have to take to keep ourselves and our patients safe in the MRI environment. It is up to everyone in the MRI department to be involved in the safety of our patients. This includes the schedulers, front desk staff, MRI technologists, tech aides, and radiologists. In today's lecture, we will discuss the importance of thorough patient and personnel screening, contraindications, and precautions for an MRI exam. We will also discuss magnetic field concerns, radiofrequency concerns, emergency procedures for a code or fire, acoustic noise, and claustrophobia. At the end of today's lecture, you should be able to identify the 7 safety administrations that regulate MRI safety. Also, differentiate between static and transient magnetic fields, identify different levels of the magnetic fringe field, discuss potential biologic concerns with patients and pregnant patients, identify different ferromagnetic objects that could become potential projectiles, identify unsafe or contraindicated metallic implants, define specific absorption rate, describe potential hazards of radiofrequency coils, identify how a quench occurs, and discuss the safety measures which follow one, describe emergency procedures for a code or fire, identify RF shielding, and discuss how and why we use it. Also, describe safety precautions for acoustic noise, and describe and discuss how we accommodate patients with claustrophobia. On your screen is a list of the 7 MRI safety organizations that regulate MRI. The FDA and the ACR are the ones we see most often. The Institute for the Magnetic Resonance Safety Education and Research and the International Society for Magnetic Resonance in Medicine Safety Group has developed a screening form that should be used as a guideline for persons entering the MRI suite. The Institute for Magnetic Resonance Safety Education and Research recommends that MRI screening be performed by trained professionals and that each person should be screened multiple times. Be familiar with these organizations and their acronyms. Everyone having an MRI gets screened. This includes patients, family members, and anyone who may be entering the MRI room. All technologists, receptionists, radiologists, tech aides, and nurses must be appropriately screened if they intend to enter the MRI scanning room. The MRI technologist must understand the risks involved with MRI. There are many implantable devices, pumps, and other electronic accessories that may cause a problem in the magnetic field and can become dangerous to the patient or staff. We generally screen patients 3 different times. The first time is when the appointment is made. This is to help the scheduler determine if the correct exam is being ordered and if any additional exams must be done in order to clear a patient. For example, a pre-screening X-ray of the orbits. The second time is when the patient arrives and checks in for the appointment. This is when the patient will fill out the screening form, and it is a key step into telling the technologist if any implants or medical conditions the patient may have. Third, we need to ask those screening questions verbally just before entering the MRI suite with the patient. Some of these questions you can ask: do you have a pacemaker, aneurysm clip, cardiac stent, or any other implanted devices? It is important to ask these questions verbally because some patients may not see it on their screening form or even understand what it is. Patient histories are sometimes very difficult to obtain. People may not remember a surgery or an implant that was done many years ago. Patients can check no to a cardiac stent on a screening form, but when you ask them verbally, they all of a sudden remember. So this is why it's important to ask these questions verbally right before entering the MRI scanning room. Contraindications. There are some devices or implants, such as a cardiac defibrillator, pacemaker, or a ferromagnetic aneurysm clips, that are clearly contraindicated for an MRI exam. These devices should never be scanned due to potentially hazardous or even fatal results. To this day, with all the knowledge we have of MRI, we still even get requests for patients who have these type of implants. It is our job to recognize and to educate physicians and patients that these devices may not be scanned. Alternatives for MRIs with patients with these implants can be made, which includes a CT or an ultrasound exam, but it always depends on what type of exam is being ordered. On your screen is an image of the reference manual for magnetic resonance safety implants and devices. Dr. Frank Shellock has compiled a list of magnetically tested implants and includes them in his book. You can also access the list on his website, which is MRISafety.com. Most facilities will have this manual readily available to check for any implanted devices. They also usually update this manual every year. Some facilities choose to keep an additional resource, like a 3-ring binder of collected information on stents or other implants that may not be included in Dr. Shellock's manual. We often come across implants and devices that may not be tested, or devices that are not included in this manual, and therefore we must contact the manufacturer to see if it is MRI compatible. Non-ferromagnetic aneurysm clips are allowed to be scanned in the MRI room, but must be cleared and documented. We must document the make and model and also know when it was implanted. Patients should carry an implant card, but we may need to obtain operative notes if the card is not readily available. This process could be lengthy, especially with surgeries dating very far back. It is important to have schedulers or whoever has initial contact with the patient screen for these type of implants to allow adequate documentation to be obtained. Some MRI safe aneurysm clips include most Yarstigil and Surgita models. Other contraindicated devices include bone growth stimulators or spinal cord stimulators and implanted infusion pumps. If a patient has had a bone growth stimulator, but since then has had it removed, still needs to be screened for this implant. It is important to obtain an X-ray prior to the MRI to ensure that the implanted metal leads or wires are not broken. If they are broken, they could become heated, or an arcing effect could occur in the wires and the patient could be hurt. In the X-ray shown above, you can see that a spinal cord stimulator is at the top of your image, and its wires are leading down to the spine into the fused area. If the X-ray shows a broken wire, the patient will not be allowed to have an MRI. Patients may also come to have an MRI and have an implanted drug infusion pump. Infusion pumps usually don't have leads or wires, just a plastic tube where the drug is delivered, but the pump itself needs to be checked for MRI compatibility. With external infusion pumps, the pumps may be removed and the plastic tubing left in the in the patient when the MRI is being done. There are many items that are not contraindicated for an MRI exam, but the FDA still has warnings for. Some of these include metal fragments or foreign bodies in or near the eyes, fetuses and infants, decompensated cardiac patients, febrile patients, and patients with impaired thermoregulation. Patients with magnetic dentures, or patients who have had permanent eyeliner or facial makeup applied, and patients with patients with tattoos may also fall into this category. Self-applied tattoos might have the highest lead content and need to be paid close attention to. These patients may not even be able to have a high field strength MRI or even an MRI at all due to the magnetic field pulling on the lead in the tattoo, which can cause heating and burning of the skin. As an MRI technologist, we need to ensure a patient does not introduce any ferromagnetic objects into the MRI suite that could become a projectile. This includes hearing aids, dentures, partials, plates, Keys, pagers, cell phones, eyeglasses, hairpins, barrettes, bobby pins, jewelry, body piercings, watches, safety pins, paper clips, credit cards, coins, pens, pocket knives, nail clippers, tools, clothing with metal fasteners, and clothing with metallic threads. Patients should be changed into a light hospital gown to avoid bringing any foreign objects into the scanning room. Some facilities just make a patient empty their pockets depending on what kind of exam is being performed. This could be a potential hazard because the patient may forget about something that's in their pocket, and it could become a projectile. Patients do not know how powerful the MRI magnet is, and we constantly need to remind ourselves how dangerous the MRI machine can be so we can screen patients properly and keep a safe MRI environment. Remember that the magnetic field is always on. Metallic foreign bodies in or near the eye has always been an issue, especially patients that are metal workers or a machinist or anyone who has ever had metal removed from the eyes. These patients must have an orbital X-ray before being allowed into the MRI scanner. The potential for metallic foreign body to heat up and cause vision damage is extremely high, and that's why we are insistent on pre-MRI orbital X-rays if a patient presents with this history. In some cases, patients will remember that they had something in their eye, but since then have had it removed. In this case, we should follow our employer's protocol, and for safety reasons, they should get an X-ray anyway, just to be sure. If something were to happen to the patient, it is your license on the line. Patients sometimes will try to talk their way out of having an X-ray, because in most cases it will delay their MRI exam, and the patient may or may not be able to get scanned right away, or may even have to reschedule their appointment. If this happens, you should explain to the patient that their vision is in jeopardy and it is our protocol to have an X-ray first, and as a technologist, our license will be at risk if something were to happen to them. At some locations, it is acceptable to ask the machinist or metal worker if they have always worn eye protection 100% of the time. If the patient is 100% sure that there is no chance of metal being in their eye due to wearing eye protection, the technologist can state this on the metal screening form and have the patient sign. This will remove the institution and the MRI technologist from any repercussions should anything happen to the patient because of the metal in or around the eyes. Just remember that you, the MRI technologist, will always have the final say into who goes into the scanning room. As of yet, there are no known biological effects from an MRI on fetuses or infants. But the research data is limited on the issue, and pregnant mothers and parents of infants are usually cautioned against having an MRI just because there is no definite data on the issue, and we like to err on the side of caution. The FDA states that, quote, MRI imaging may be used in pregnant women if other non-ionizing forms of imaging are inadequate, or if the exam provides important information that would otherwise require exposure to radiation, end quote. If it is deemed a medical necessity that the expectant mother have an MRI by both her referring physician and the radiologist from your institution, it is also helpful to wait until you're at least past the first trimester. This may limit any ill effects that could be caused during the most crucial time of fetal development. This policy may change by facility, but it is important to understand that the department protocol and check with a radiologist before scanning any pregnant person. In 1991, the Safety Committee of the Society of Magnetic Resonance Imaging issued a statement as to follow. Quote, these patients should be informed that, to date, there have been no indications that the use of diagnostic MRI imaging during pregnancy has produced any side effects. End quote. This policy has been adopted by the American College of Radiology and is considered the standard of care for MRI procedures with respect to pregnant patients. Another potential problem in pregnancy and potential risk to a fetus may be heating. Heat is able to disturb the growth and development of a fetus, but the heating from the MRI exposure is almost equal to a pregnant woman being in a steam room or a hot tub, which is not recommended. Even though there are known biological effects that some pregnant technologists decide to err on the side of caution and they choose not to enter the MRI suite until at least second trimester. In addition to being conservative, technologists should also not remain in the scanning room during a scan. This is when the gradients and the RF energy are being applied. This is simply because we don't know of any long-term side effects. Permanent eyeliner, facial makeup, body lotions, deodorants, and tattoos may contain ferromagnetic particles and can cause heating in the area of the body which applied. Older or self-applied tattoos may contain higher concentrations of lead ink, and these patients are at higher risk for heating. The lead in the ink can actually be pulled by the magnetic field and cause redness and irritation to the skin, and even heating and burning in the area. It is important to maintain constant communication with any patient who has these types of particles or tattoos, and make them aware of the possibility of heating. The MRI tech must be told as soon as possible if heating occurs, so the patient can be removed from the MRI suites and evaluated promptly. Patient overheating is another issue in MRI due to the gradient and RF coils used in the MRI system that can cause an increase in body temperature in the patient. Decompensated cardiac patients or patients in heart failure are at potential risk while undergoing MRI exams. These patients often have shortness of breath when they are lying flat and are already experiencing circulatory problems, which can lead to overheating. Febrile patients are usually experiencing some form of a fever and therefore are unable to regulate the heat generated from the MRI machine within their body. Patients with impaired ability to perspire have to be monitored closely as to not get too warm in the MRI scanner. All of these patients should be changed into a light hospital gown to reduce the risk of elevating the patient's core body temperature. Most MRI scanners have a fan that brings fresh air into the inside of the magnet to keep the patient cool. Overheating is an issue with larger patients due to the use of more RF energy to create the MR image and the lack of airflow within the bore of the magnet. These patients should be monitored closely and brought out of the scanner to cool down if necessary. All support staff and personnel working in the MRI suite must not have any kind of ferrous implant or contraindicated device. It is our responsibility as the MRI technologist to ensure that no one enters the scan room with any ferrous objects or that a person that has a contraindicated implant or device enter the room. If ancillary personnel such as an ambulance crew, radiology nurses, or anesthesiologists frequent the area, it is important to have an updated medical consent form filled out by each individual on hand to ensure their continued safety. This is an example of an MRI screening form. All patients must fill one out prior to having an MRI. Questions that should be covered on the MRI screening form are: do you have a history of any metal work or metal damage to the eyes? Have you ever had a bullet fragment or shrapnel anywhere in the body? Do you have any stents or heart valve implants? Do you have any bone fusion or bone growth stimulator implanted? Do you have an internal infusion pump? Do you have a pacemaker, neurostimulator, or defibrillator? Have you ever had brain surgery? Have you ever had aneurysm clips? Do you have any orthopedic implants? Have you ever swallowed a camera pill for a GI ulcer exam? Do you wear dentures, hearing aids, or have an ear implant? Do you have any mesh implants, wire sutures, staples, clips, or electrodes? Have you ever had a vascular access port or catheter placed? It is also important to screen for any allergies if the patient is getting a contrast reaction. Do you have seasonal allergies, allergies to MRI contrast, or any other type of contrast, asthma, or respiratory disease? Have you ever been diagnosed with diabetes, renal disease, or high blood pressure? Do you have any liver disease or sickle cell disease? Have you ever had a liver transplant or renal transplant? Also, we need to screen for pregnancy, tattoos, permanent eye makeup, body piercings, and drug patches. If a patient answers yes to any one of these questions, the MRI technologist needs to be clear if the device or implant is safe for the MRI exam, and if unsure, we may need to acquire an implant card or operative note for that device. In cases of any allergies or renal or liver disease, if a patient needs a contrast injection, it must be determined by the radiologist if any pre-medication is needed prior to the injection. You will discuss IV contrast issues further in the class during your MRI contrast and NSF module. It is extremely important that any equipment entering the MRI suite be MRI compatible and labeled properly. There are ferrous stickers available, and they should be placed on items such as scissors, utility knife, or any ferrous items in the MRI department that should not enter the room. Crash carts and stethoscopes must also be MRI compatible, but crash carts should never be allowed into the MRI suite in the case of any ferrous content inside. Some inpatients that come for an MRI exam may have a drug infusion catheter or a drug infusion pump. These devices are usually hooked up to an IV pole and must not be allowed into the suite. Extension tubing must be supplied, and the pump should be left outside the MRI room with extension tubing running underneath the scan room door to the patient inside. Some patients have a nasogastric tube or urinary catheters, and we must make sure that these devices are free from any metal and cleared before entering the MRI room. If you are unsure about a ferromagnetic property of any equipment, a handheld magnet should be used to test to make sure that it's safe for the patient and the technologist. The technologist should constantly monitor the patient through a scan view window and the overcome system. They should be given an emergency call button and instructed how to use it if an emergency arises and they need to be removed out of the scanner quickly. Every MRI technologist should know their department's emergency procedures in case of a patient emergency. The patient must be immediately removed from the MRI suite and placed into a holding area. The radiologist on duty should be alerted next, and a code should be called if necessary. Institutions should have an emergency protocol placed for these situations, and they should be practiced to ensure readiness if an emergency arises. The first step in case of a code is to remove the patient from the scan room. There is no way of shutting down the magnetic field quickly enough if using a superconductive magnet. The patient must be taken to a nearby holding room to perform emergency procedures safely outside of the strong magnetic field. Do not allow emergency personnel into the MRI suite. We also do not want to allow a crash cart into the MRI suite. Even if the crash cart is rated MRI safe, the contents may not be. MRI facilities should have an emergency procedure in place in case of codes. These procedures should be practiced regularly so the staff is clear on what to do if this ever happens. If a fire occurs in the MRI suite, we first need to turn off all electrical power to the MRI scanner, since it probably will be an electrical fire. All patients and MRI staff should be evacuated, and the doors to the MRI suite should be closed to limit the spread of the fire. If the MRI system is a superconducting or permanent magnet, there will be no way of turning off the magnetic field quickly. Your local fire department should have procedures for emergency MRIs and should understand that the magnetic field will be on. Non-ferrous firefighting equipment also needs to be accessible and when using fighting fire around the MRI system. Also, MRI safe aluminum fire extinguishers should be used in every MRI suite and should be labeled as such. A quench is a rapid release of helium gas from a superconducting magnet. When liquid helium evaporates, it expands into a gas many times larger than the liquid volume. This is an image of a new MRI system that was being installed when it suddenly quenched. The pressure of the gases inside of the magnet caused an explosion and destroyed the scanner and damaged the walls and ceiling around it. A quench will be very loud, and the magnetic field will be partially or fully lost. A quench can occur manually if a patient is trapped by an object that is too large to be removed when the magnet is at full strength. A quench can also occur if the liquid helium is not being replenished when it is needed, or during the helium refill process. Most newer MRI systems operate on a closed helium system or cold head system, and helium fills aren't needed as frequently as in the older systems. Vents are positioned in the room above the scanner to vent out the gas outside if a quench occurs. An oxygen sensor should be in place that sounds an alarm if the oxygen in the room falls below a certain level. But in case of a failure, evacuation is the best course of action. It is important to remove yourself and the patients from the MRI suite due to the potential risk of suffocation and hypothermia from the lack of oxygen in the room. Frostbite can also occur if a patient and personnel aren't evacuated immediately. It is extremely important to know the location of the emergency power switch and the magnet quench button in case a manual quench is needed. You must be familiar with the protocol set forth by your institution and practice it in case of a magnet quench. In older negative pressure rooms, this is where the scan room door opens inward, you may need to break the MRI suite window to allow positive pressure into the room to be able to open the door to remove the patients. Newer MRI suites are designed so that the door opens outward and negative pressure in the room does not incur. If the door opens inward, this could potentially cause a vacuum, which will prevent you from opening the door and be the reason why you need to actually break the window. The FDA has restricted the amount of RF energy that can be transmitted into a patient's body. This is called the specific absorption rate, or SAR. SAR has units of watts per kilogram and can be expressed as an average of the total body or local to a specific tissue. SAR is highest with pulse sequences like fast spin echoes and techniques used with MRI spectroscopy that may have a 180-degree RF pulse. System manufacturers have set SAR limitations, and they may be about 100 times lower than the levels known to cause any kind of biological damage. SAR is more of a concern with higher field strength systems, usually 3.0T and up. Always type a patient's weight in correctly so that the MR machine can calculate an accurate SAR level. RF coils send RF energy into the patient and also collect the MRI echo or signals produced from the patient. The safety issue with RF coils have to do with heating. If not used properly, patient overheating, burning, and coil damage can occur. Never use two coils at the same time. Do not leave a second unplugged coil in the scanner during an MRI exam. This could potentially damage the coil and harm the patient. Also make sure to use padding between the coil and the patient to avoid direct contact with the patient's skin in case of heating or irritation or burning, which could occur. We have to be very careful with the RF cables in the MRI scanner. Coil cables and coils used on monitoring and gating equipment should be shielded and grounded. Any loops in a cable can cause an arcing effect to occur, and the patient could be harmed. Cables on all system components need to be inspected routinely for breaks in the installation. It is very important that when positioning a patient for an MRI that the cables do not come in contact with the patient's bare skin. You can insert a pad between the cable and the patient or wrap the cable in a sheet or pillowcase to prevent this from happening. If a cable has direct contact with the patient's bare skin, burns to that area may occur. Radio frequency, or RF shielding, is used to keep unwanted AM radio frequencies from interfering with the image produced from the MRI scanner. It also keeps the radio frequencies used in the MRI scanner for interrupting communications outside of the MRI suite. RF shielding is generally made from copper or stainless steel and is built into the walls, windows, and doors of the MRI suite. Special care is taken when designing and building an MRI suite so that electrical wires, air, and oxygen supply access is properly RF shielded. If RF shielding is not adequately obtained, signal loss and artifacts may appear on the image. The FDA has two concerns regarding the magnetic field. Number one, the maximum static magnetic field, where some MRI scanners have a static magnetic field up to a 3 Tesla or higher, and some research magnets can even be 8 Tesla or higher. And number two, time varying or transient magnetic fields, where A, the magnetic field must not exceed a change greater than 6 Tesla per second, or B, the Z gradient magnetic field must not exceed a change greater than 20 Teslas per second, and the X and Y gradient must not exceed a change greater than 60 Tesla per second, where the pulse width is greater than 120 microseconds, or C, to ensure the rate of change of the magnetic field will not cause peripheral nerve stimulation in the patient. All of these allowable levels are set well below the level of concern for a patient's safety. In patients where these levels are exceeded, they may experience involuntary muscle contraction, cardiac arrhythmias, or the appearance of flashing lights. We, as MRI technologists, have to be aware of the potential metal projectiles. The technologist or patient can be seriously injured if a ferrous object is allowed to enter the MRI suite. Any ferrous object has the potential to become lethal, a lethal projectile when introduced to the magnetic field. This attractive force has an exponential relationship, so that the object that is 10 feet away from the magnetic field will have a small attractive force. But when the same object is moved to 5 feet away, the attractive force at least becomes 4 times greater. Know what the terminal velocity of a paperclip is when being pulled into a 1.5 Tesla magnet. This will be on a quiz and can be found in your MRI practice, chapter 10. We need to make sure that the MRI suite is a restricted area for all patients, and personnel are properly screened and removed of any ferrous material. Signs must be clearly posted to warn the staff and patients of potential dangers of the magnetic field. Door locks and or key code boxes should be in place of the MRI suite doors to ensure that no unauthorized staff or patients enter the MRI suite. Some facilities have limited access doors to the MRI department as an added safety measure. If doors to the scan room are left open, anyone could accidentally walk into the room. The last thing we want in our MRI department is for a patient or unauthorized personnel to wander into the MRI suite without being screened. We talked a little bit about pacemakers being contraindicated for an MRI, but we also have to take into account patients not having an MRI but are still near the suite or just passing by, and if they have an implanted pacemaker. The fringe field is the distance from the magnetic field extending outside of the bore of the magnet, and is why we have guidelines for where patients and personnel can be. Patients with pacemakers must not experience more than a 5 Gauss magnetic field. Every technologist should know where the 5 Gauss line is. It should be contained within the scan room or restricted areas. Factors that affect how far the fringe field extends are magnet field strength, geometry of the magnet, type of magnetic shielding, and the overall design room of the scan room. MRI systems are generally positioned in a very large room to ensure that the fringe field is contained within the room. High field magnets use passive or active magnetic shielding, since the fringe field extends far from the center of the magnet. Both types of magnetic shielding act to contain the main magnetic field within a small area. You can see in this picture, even with active magnetic shielding, how far the magnetic fringe field extends from the center of the magnetic bore. As stated on the prior slide, the 5 Gauss line should be contained within the scan room. Most MRI suites are large enough for this to happen. In most cases, we, the technologists, are sitting at a scanner console, which are in or around the 1 Gauss line or less. The magnetic field gradients that rapidly switch on and off are the primary source of noise in the scanner. The loud tapping or knocking noise may scare the patient and create problems communicating with the patients, and even cause temporary hearing loss. EPI, or echo-planar, imaging techniques require more rapid gradient switching and have higher noise levels, but are still below permissible levels set by the Occupational Safety and Health Administration. EPI sequences tend to be very short in duration, and the shorter time exposure to the louder noise may be actually less of a problem. These sequences still do not cause hearing problems, but for a patient comfort, we must always supply ear protection. Drawbacks to headphones or earplugs are that they may make it difficult to communicate with the patient. Because of this, it is especially important that the MRI technologists visually monitor the patient and communicate with them as needed. It is also helpful to give the patient the alarm switch or call ball so that if a problem arises, all the patient must do is squeeze the call button and an alarm will sound near the technologist to ensure a rapid response. Now we need to talk about claustrophobia and anxiety in MRI. The claustrophobia rate in patients can be as high as 20%. Preparing the patient for a specific exam they are having can alleviate most claustrophobia and anxiety problems. This can be done by having a patient watch an educational video before having their exam. Patients should be allowed to ask questions that they may have before the exam. Some patients find it helpful if a friend or relative accompany them with the MRI suite. Music can be used to calm a patient and protect them from acoustic noise. They may also be allowed to have their favorite CD played if they choose. Some patients do better prone or feet first instead of head first. Some people find it helpful if they don't see the inside of the magnet. A blindfold or washcloth over their eyes can help considerably. Diazepam or other anti-anxiety medication can help patients get through the procedure. Using these usually require written consent by the radiologist, and a driver must accompany the patient to their exam. In all cases of claustrophobia, just talking regularly to the patient can be the most helpful when comforting them and getting them through their procedure. For example, patients like to hear, "This next sequence is about 4.5 minutes. I'll talk to you as soon as it's done." Or, "The next scan is 5 minutes. You're doing a great job." Or, "We're only halfway done. Or, only 15 more minutes to go. Keep holding still." This human contact over the intercom can be the only thing that gets them through the test, and it is our job as MRI technologists to keep a constant contact with the patient. In addition, for every patient, they're given the emergency call button. Anxiety may be instantly decreased because they know that the alarm will ring, which will enable a technologist to move quickly and remove the patient from the scanner if they desire. This must be explained to them so that they know what will happen if they choose to use the call button. This concludes the presentation on MRI screening and safety. Make sure to review the importance of patient and personnel screening, know the contraindications for MRI, and the precautions are taken with certain implants or devices. Review biologic effects of the magnetic field on patients. Know that there are emergency procedures in place and what to do if a code, fire, or quench were to happen. Understand that the magnetic field reaches far beyond the magnet itself, and that there are potential risks with the patients that have pacemakers and other ferrous implants. Review the effects of acoustic noise on the exam and the patient on how claustrophobia can be alleviated. Please make sure to also review the safety and claustrophobia tips on page 348 and 349 of MRI in Practice. Thank you very much, and I'll see you in class.